The Delta variant has shown a steep increase in hospitalizations across the country, specifically in children amid the coronavirus crisis. And according to the CDC, weekly COVID-associated hospitalization rates among children and adolescents rose nearly fivefold during late June to mid-August of this year. Let's bring in physician at Stanford Children's Health, Dr. Alok Patel, for more on this. Dr. Patel, great to have you.
Kira, it's good to see you.
So let's talk about just how dire the COVID crisis is for kids right now. There is some good news on the horizon, though. Pfizer has announced that there's a decreased dose of the vaccine is safe and effective for kids 5 to 11. Now the company just needs the FDA approval. So how soon could younger kids actually get vaccinated, and what kind of side effects do you think they could have?
Well, Kira, off the bat, I will tell you the answer to the second part of what you were asking is that based on this data, which actually looked great, preliminary data, it's non-peer-reviewed, and it was a press release from Pfizer, but this antibody level seen in these 5 to 11-year-olds is comparable to older teens, and we knew that they were very well protected from the vaccine. So if everything goes according to plan with the FDA, we could potentially see shots in arms by Halloween, trick or treat for your immune system. Hopefully it's going to be all trick. Now, based on the press release from Pfizer, there were no adverse side effects seen in this age group. And that's what a lot of parents out there, and I respect parents being very vigilant about taking care of their kids. That's what they're going to be looking for. And that's what all the data is going to hopefully kind of be looking at with the full FDA approval, which is obviously more than a press release. But yes, the situation and the rising cases in children is very concerning, especially in those southern states that are being hit really hard right now.
Absolutely. Parents are going to watch those results very closely. And Dr. Patel, the U.S. has surpassed a grim milestone on Monday. The COVID death toll has now topped the death toll in the 1918 flu pandemic. And when you think about that, the level of technology, the level of understanding, the level of medicine that we had back then, and in this pandemic, more Americans have died than back then. And the hospitalizations are now slowly coming down. I just want to get your thoughts on this milestone, what it says about us, and what your sense is. Are we coming out of this particular surge and the way forward?
Terry, I don't know if I have an hour to give you a TED Talk filled with frustration and me banging my head on the wall, but this was completely preventable, especially if you look at the actual graph showing how we've gotten to over 600,000 deaths. We had multiple opportunities to curb this. And if you look at those white flags right now that are memorial for everyone who's lost their lives, I mean, it's pathetic. Now, this pandemic showed up like a big spotlight, and it just exposed all the cracks in our healthcare system, our socioeconomic system, and the sheer division in people's trust in science and how that's played in with political differences. And it's terrible. You know, I hope we look at ourselves right now and we realize that we actually know what we needed to have been doing in the past. And we can identify these places where people chose the wrong road, and they still are. And there's going to be another pandemic. There's going to be another crisis in the future. That's just unfortunately how things roll out on this planet. And I'm hoping that going into this winter, we don't see yet another rise in cases. It's completely preventable.
So, Dr. Patel, Tennessee says that it will recommend that nearly all vaccinated people be denied the monoclonal antibody treatments to try and preserve supply for people who made the choice to be unvaccinated. So, as a doctor, what do you think of that decision?
You know, the reason I shook my head is because you said people who made the choice to be unvaccinated who are now getting preferential treatment for antibodies, which, you know, I understand from a pure scientific point of view, from looking at the recommendations from the NIH, we want to save that limited supply for people who are most likely to get hospitalized and die. And yes, technically that does mean people who are unvaccinated, but there's some shades of gray, Kira. And if you look at the reporting right now this morning, it doesn't look like, you know, the Tennessee Department of Health has actually put their stamp down. It looks like they're still considering people who are unvaccinated and meet the other criteria, such as older, you know, symptoms within 10 days. I'm sorry, getting the treatment within 10 days of the positive test and symptoms, but also those who may be partially vaccinated or those who are vaccinated and maybe have an underlying medical condition that prevented them from building that big, robust, you know, antibody response to the vaccine. But if people are unvaccinated and they're getting rationing care, should we talk about rationing care in the hospital where unvaccinated people are taking beds that could be used for other people, say heart attack or stroke patients? It's a really tricky situation.
There have been situations where they have rationed intensive care unit care, as I know you know. Now, let's turn to some good news. Johnson & Johnson released their data about their booster shot, saying a second dose given 2 months later is 94% effective against symptomatic COVID, and it raises antibody levels as well. And a booster shot at 6 months provided a 12-fold increase in antibodies. That's the way booster shots should work. So how about the people who did get the J&J shot more than 6 months ago? What is your advice for them?
Well, the first thing I will say to anyone who got the J&J shot is the real-world data for people who just got one shot is still showing above an 80% efficacy rate against severe illness, which is what the vaccine was designed for. So even if you got one shot, you still have great protection. And this is really important when we talk about a global distribution plan, because a lot of places out there, one shots is going to be the fastest and best way to provide protection. And obviously, this is a great day for Johnson & Johnson because, the vaccine given in a 2-dose series within 2 months showed great efficacy, and it showed a boost in antibodies, and even more so, as you mentioned, 6 months later. And scientists think that might be because once the antibody levels start to wane, a little extra boost at that 6-month mark might pick them up. And I just have to say, Cedric the Entertainer at the Emmys made that joke, called Johnson & Johnson the TJ Maxx of vaccines. That may be untrue now because this is great data for them.
Oh. Dr. Alok Patel, thank you so much.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.